The psychological stress is crazy, and everyone being at home is crazy, and the kids' school is crazy. It's like everything is crazy.
Yeah. Yeah, I can
Yeah.
imagine having all of that on top of what you guys have to do.
That's what I have to do is I'm actually lucky and get to go to work. So
Yeah.
I'm the lucky one.
I know. There's so many people that have been let go on top of it all, and that's just
I know. Or
heartbreaking.
even worse yet, furloughed, not let go, but furloughed, you
Yeah.
know?
Yeah.
Yeah.
A couple of TV stations started doing that too, and I was like, "Oh, great." So,
Here it comes, the chopping block.
you
Yep.
just
Terrible.
holding on. I don't know if there's anything you can lean your iPad on just so it's not shaky. If not,
Okay. See?
we'll see.
How's that?
Perfect. And then I don't know if you can center up just a little bit. Usually I don't care, but we got to make you look good, Todd.
Yeah. How's that?
Perfect.
All right.
All right, I guess I'll just jump in because I know you're a busy guy. How have things been there at the hospital for you?
So, I mean, there at the hospital, things are great, like they always are. New York City, different story. And I can only speak to my own hospital.
Mhm.
I hear a lot of things in the media. People don't have enough PPE. They're working around the clock. We have a lot of volunteers that have stepped up, both in the hospital and outside the hospital. People have come from other states to help us. I feel like we're well staffed. I'm working 12-hour shifts. I'm not doing what I normally do, though. I'm not doing vascular surgery. I'm working both in the ICU and on the floors covering all COVID patients. So it's not what I'm used to doing, but I won't say the job is very difficult. Everybody's got the same problem. They all have respiratory distress. They come in, they need some oxygen, and we're giving varying levels of oxygen with the goal being to try to wean it off, titrate it down, and get them home.
Absolutely. Can you talk about, I don't know if you can talk about how many people are actually being treated for COVID at your hospital?
There are hundreds. I want to say somewhere between 400 and 500 patients at our hospital, somewhere between 100 and 200 patients on ventilators.
Yeah. What's the struggle with having so many people with the same problem um, daily?
The struggle is they all need the same resource, that ventilator that everyone's hearing about. At any given time, our hospital is only, and I'm guessing here, maybe 10% ICU. And now we're needing it to be a 50 to 70% ICU kind of situation because the number of patients that are so sick.
Yeah. Being a surgeon, you probably have learned patience and this calm demeanor that I'm seeing from you. Do you feel that way inside? Are you calm about this situation?
I do. I've always felt like the Waffle House chef at 2 a.m. on a Friday night, pre-COVID, has a way more stressful job than me. I think stress is how you internalize it. I'm doing what I enjoy. I don't feel overburdened or overworked. And the things that are coming at me are the same thing. The first day on the wards, I was a little worried. It was back to my internship days with ordering labs and doing discharge summaries and transfer notes. After several hours, I've got back into the swing of things, and I'm the best intern there is.
Have you had to brush up on, respiratory illness, stuff like that to get back into that field?
Absolutely. I feel like before I was called up into action, I was looking at everything from this 30,000 foot down. I was following Wuhan, I was following Italy, looking at Washington, trying to understand everything. And then as it got closer and closer to New York, I started reviewing the actual details of ventilator management, the different strategies on how you want to oxygenate these patients, the different medications that we're giving and what doses. So I absolutely had to review it, and I review this stuff every day. It's also a moving target. What we knew a week ago is we've evolved and improved upon this week. So it's really a moving target.
Do you miss your surgeries right now?
I do miss them. Yes, I do. This is the new normal for now. I feel like it's not even an option to go back to that way right now until this wave brushes by. I think that it's a call to action to take care of these patients, to try to get back to some sense of normalcy. I don't think we'll ever be totally normal, but as soon as this wave, this tidal wave of patients really diminishes, we won't have any vascular surgery or elective procedures. We are still doing emergencies and like ruptured aneurysms, things of that nature, but those are right now being handled by my partners while I'm being deployed on the COVID floors.
What do you mean by, we'll never be back to normal? What does that mean for you?
I think that everyone's going to always have a keen eye on social distancing. In a year from now, when somebody coughs over your shoulder, you're going to say, "Ooh, what the heck?" You'd be a little bit more grossed out and disgusted by those things that we probably took for granted 2 months ago.
Yeah, I was never a germaphobe, which I don't know if that sounds gross to people or not, but I really wasn't worried. And now I'm like, my life has changed along with everybody else's, but I think that's definitely something that'll stick with me.
Yeah, that's going to change. Everyone's work with Zoom video, the nature of this interview right now over Zoom, our webinars that we have weekly talking about it. We are doing, before I was on the COVID floors, and next week when I'm off the floors, I'll be doing video visits with patients. This is not something that was done commonly in our practice. And I think that, out of every disaster is an opportunity, and I think we'll all learn from this.
Yeah, I had a good question that popped out of my head that happens to me all the time. I guess, how long do you think that your role, working on the COVID floor will last, through this whole pandemic? Will you be there? Do you have any sense of how long that will be?
I feel like it changes. I would have thought like last week that it would have been more like 3 or 4 weeks. I'm thinking now that it could be between 3 and 6 weeks. I think we just don't know. What we're doing within my group of 8 doctors, 8 vascular surgeons, we are kind of rotating each other in and out of the COVID floors. We have to maintain a group off service to maintain the vascular emergencies that come through at the 3 hospitals I work at. But a lot of us are wanting to step up and help how we can. We just can't do that in large numbers and leave our other vascular patients uncovered. The other issue is falling to the illness itself. There's a high chance that healthcare workers could actually contract COVID as well. And so we've allotted some leniency into the schedule and a little bit of redundancy just in case one of us gets sick.
That's obviously a big worry for everyone. I'm afraid of getting it. I've been very careful about not going out, but you're right next to it every day. Are you scared of getting this virus?
I wouldn't say that I'm scared of getting the virus. I'm very careful. I try to do frequent hand washing. I wear full PPE when I'm seeing these patients. This is just a mask that's mandatory to wear around the hospital. This prevents anybody with COVID from spreading it. And we all act like every person you see, doctors, nurses, patients, has COVID, so you wear this. But when you walk into a COVID patient's room, you're wearing full PPE because it is a respiratory and droplet disease as far as we know. So you're wearing the N95 respirator, an eye shield, a hair bonnet, and then full gown.
Yeah, yeah. Yesterday you mentioned briefly that your main goal for people that have symptoms is to not have them on that ventilator, because once they get on it, they rarely come off. Can you expand on that?
I wouldn't say they rarely come off, but there's such a high chance when patients start doing poorly and they get on that ventilator, they tend to be on the ventilator for a week or two or more at a time. The average ventilator times we're seeing are a number of days more than usual disease patterns that we've been seeing up to now. So we try to do everything we can to keep somebody off a ventilator. Once they go on, it's not a guarantee they're coming off. It's not a death sentence by any means, but there's a really high likelihood that they may not come off that ventilator.
Is this virus really so different from all the other ones that, medical professionals have seen in the past?
It has to be, right? Because it's filling up our ICUs and our hospitals unlike the flu or anything else ever has. It's very frustrating when you hear some non-believers out there say, this is nothing more than a flu. A flu doesn't hospitalize 20% of patients and kill 2% of patients. This is much worse. I think that we're all at risk. Our immune systems haven't seen this bug yet, so none of us really have an immune response to this. I'm really looking forward to a vaccine that could help prevent this from happening, or an IgG antibody test to see if we've been exposed or have the antibodies against it. Some people are manifesting disease in a very minimal way and may develop antibodies and be protected against this in the future. And patients who are have already had it and recovered and have this sufficient immune response, those patients, ideally, would be the first to return to the workforce.
Yeah, that's something I've been really curious about is, once this just mass surge of sick people, pass, when are we safe to go out again? Are we going to keep getting it? When is life going to return to normal?
And that's why I don't know that it ever will return to normal. I think that this bug will disappear completely. Unlikely. We'll have a vaccine for it, hopefully. We'll have better treatments for it, likely. Or we'll eventually get it and have our own. And if we don't die from it, which the chances are we won't die, most people do not die from this disease, the chances are you'll recover and you'll have antibodies that will hopefully protect you in the future. Now, viruses do like to mutate, they can change, and it could still make you potentially susceptible in the future. We just don't know. And I do think that future vaccines will look at that and take that into account, similar to a flu vaccine.
Yeah, I wish testing was a little bit more efficient just because, I think everybody wants to know, well, have I had it? And did I just not show symptoms?
Yeah, the issue with testing is, number one, people that have all the right symptoms, who don't have severe problems, don't need the test. You have it. If you've got the fevers, the aches, the cough, you've got COVID. You don't need to go to the doctor. You need to self-quarantine. Those who have severe disease to the point where you are very symptomatic and need to come into the hospital, we test patients, but the false negative rate is very high, meaning that a lot of patients that have it, when you do the nasopharyngeal swab, that comes back as negative because the test, again, is only 60 to 80% sensitive. So it's a little worrisome when you've got a test that's not perfect. Again, improvements are being made on this. Other companies are coming out with better, faster, more accurate tests, and that will be very welcome to the medical community as well.
Yeah, absolutely. Um, I guess what can Florida learn from what New York is going through right now? Because obviously our numbers are climbing. They're probably going to keep climbing for the next few weeks. Any tips or suggestions for medical professionals or people?
Yes, for frequent hand washing, social distancing. I personally believe that that has really worked in New York to flatten the curve. Had we just ignored this, I think the problem would have been much more dire. And the fact that we are at capacity at a lot of these other surrounding hospitals in the city shows that any more would have just really pushed us over the edge. So I think the hand washing, the social distancing, wearing the masks out in public, and certainly when you're in a closed space, I think all help prevent the spread of this.
Yeah. Can we talk a little bit about family? I know that obviously you're a family guy. You sent your family away, basically.
Yeah, I have the privilege of being able to do that. Not everybody, not every doctor or nurse has a second place where they can send their family. My wife and my kids are an hour outside the city where she's working from home and they're being homeschooled there. I miss my kids. I don't know when I'll see them again. I do get to FaceTime with them every night, and I actually FaceTime them to sleep. We'll put the iPad next to the pillow, we'll click on FaceTime, and I'll sit there right with them while they're falling asleep, telling them a story, listening to their day as if my head's right next to theirs on the pillow, just through FaceTime.
Yeah, to keep them safe.
To keep them happy.
Yeah, yeah,
Yeah,
but far away from all of the chaos and people.
yeah.
Yeah. Any worries about, family in Florida? You have parents that are in that more vulnerable group. You have your sister and her family down here.
Yeah, I've always said I worry more for people my parents' age. I worry more for my parents than for my kids. This disease tends to infect children, but not in any bad way. There have been obviously reports of infants and children succumbing to this disease, but it is very, very rare. Children are definitely carriers of it, so it's very easy for a child to give it to grandma or grandpa. But yeah, Florida with its older population, especially down south, I certainly worry for my parents. Ever since we went on lockdown here in New York 3.5 weeks ago, 4 weeks ago, I was on top of my parents, insisted they lock down. They've been doing a pretty good job, I think. So I think that's what they tell me at least. So I think they're doing all the right things. But still, even doing all the right things, this thing is very pervasive. It's ubiquitous. It's everywhere and very contagious. And I think if you're not washing your hands, wearing a mask when appropriate to not spread the disease in case you're an asymptomatic carrier, then you're doing a real disservice to the community.
Yeah, yeah, I agree. I think the people most at risks, like mothers, fathers, grandparents, they have a little bit more of a carefree attitude, some of them.
Yeah, I don't know if that's for better or for worse.
Yeah.
They're the ones most likely to be affected, though. So, I feel like they should take it seriously.
I watched something on the New York Times. I don't know if you saw it, but it kind of was like a explainer as to why COVID kills. It made even the layman like me kind of understand, okay, that makes more sense, kind of like a lining blocking the oxygen from getting to the lungs, basically, right?
Yeah, more or less. I'd be curious to know how it kills too. None of us really know. What we do know is that there's a receptor on the outside of the virus. It's called ACE2, an angiotensin converting enzyme 2 receptor. ACE2 receptor protein that binds this protein in our lungs. It also exists in our GI tract. So this virus loves to attach into our lungs, and then it creates this inflammatory response.
Right.
And most often patients tend to, I guess, do poorly when this cytokine storm happens. Right before somebody dies, they tend to have a surge of all of these inflammatory markers that are detectable in their bloodstream. And that's when there's really not much more that you can do for somebody. Those are the final day or so of life that we'll see in these patients. And this is just from my experience in the ICU and on the floor from what I've seen.
Yeah. And is there a way for people to prevent their symptoms from getting worse?
Um, I think that this is a virus that runs its course. I don't think that these drugs that are being touted in the media are for everybody, namely the hydroxychloroquine or Plaquenil and azithromycin. We do give this to patients in the hospital. There's no hard data showing that it works. Social media seems to be accusing of healthcare providers of withholding this medication, but this is something that we've been giving for weeks to most patients who are symptomatic who we admit to the hospital. We give them these medications and zinc to help with the absorption of the medications. And that's really what we are giving as far as trying to shorten the course of the duration of it. Really what you're trying to do is treat the symptoms. You're trying to give oxygen. At home, obviously you can't do that, but what we find in the hospital, one trick is to go prone or lay on your belly. When you lay on face down, the blood perfuses the lung in a different way, and you could get blood to different areas where oxygen may or may not be. So a common strategy in the hospital is to rotate patients from supine to prone or from their back to their front. And at home, if you're feeling short of breath and you have this and you're fighting the urge to go to the hospital, and it's very uncomfortable from what I understand, I haven't had it, one strategy I would recommend is trying to employ this rotating onto your belly into that prone position if you're finding yourself struggling to breathe. Again, at the end of the day, if you're really struggling to breathe, that's the time to go to the hospital.
I don't think that's going to work for me. I'm 9 months pregnant.
No, you don't want to be there. Right.
I guess any words for encouragement for people? I think I'm finally on the upturn. I was kind of down for a couple weeks, but I'm feeling a little bit better. It's definitely a mental game right now.
Yeah, it's all a mental game. There's certainly a physical part of this. This virus is here. It's not going to be here forever, or I should say it will be here forever, and we will learn to live with it. We will either become immune via vaccine or a minor infection, hopefully. And just like everything, this too will pass.
All right. Anything that I'm missing that you feel like is really important to share?
I will say just be careful what you hear on social media. I get very frustrated. People propagating misinformation and saying bad things about this not being a real problem or about politicizing this in any manner. I just don't think there's any room for politics and certainly for passing on fake news. This is not a time for any of that.
It's a good time to clean out your Facebook friends for everyone who's sharing fake news.
Exactly.